In a bold move that has sparked controversy, U.S. Health Secretary Robert F. Kennedy Jr. has selected 7 new members for the Centers for Disease Control and Prevention's CDC Influential Vaccine Advisory Panel, according to an internal document obtained exclusively by Reuters. This decision comes hot on the heels of Kennedy's controversial dismissal of all 17 previous panel members back in June, raising eyebrows and concerns over potential bias in vaccine recommendations. But here's where it gets interesting. The newly appointed members include Dr. Raymond Pollack, a retired transplant surgeon with expertise in immunology, who confirmed his consideration for the role, pending a thorough vetting process. Other nominees comprise Dr. Joseph Freeman, an emergency medicine specialist from New Orleans, Dr. John Gaetanis, a pediatric neurologist, Catherine Stein, an epidemiology professor, Hilary Blackburn, a pharmacist, and Dr. Evelyn Griffin, an obstetrician-gynecologist. The identities of these potential new faces on the panel have been revealed by Inside Medicine, a Substack blog, earlier today. While the Department of Health and Human Services, HHS, has directed the CDC to appoint these new members to its Advisory Committee on Immunization Practices, ACIP, the decision has not been without its critics. With Kennedy, a known vaccine skeptic, handpicking the new members, many worry that the panel's independence in making vaccine recommendations may be compromised. And this is the part most people miss. The ACIP plays a critical role in deliberating and voting on vaccine schedules and recommendations after FDA approval. Insurance companies often base their coverage decisions on the panel's advice. However, the recent shakeup has led to the departure of several high-ranking CDC officials, including former CDC Director Susan Monterez, who was dismissed after clashing with Kennedy over vaccine policy changes. Her exit prompted the resignation of 3 other top CDC officials, citing concerns over Kennedy's anti-vaccine stance. The new panel is set to convene on September 18th, where they will likely discuss and potentially vote on vaccinations for hepatitis B, measles, mumps, rubella, varicella, and respiratory syncytial virus, as detailed in the Federal Register. It remains to be seen how these changes will affect the panel's future recommendations and the public's trust in vaccine safety and efficacy. What do you think about Kennedy's decision to overhaul the CDC vaccine panel? Share your thoughts in the comments section below.